excited to continue on with the PNTC and our alliance work, sharing some perspective based on issues that really relate to the public health community, those of you working in the front lines in healthcare, and many of our navigators and community health workers who are, again, on the front lines related to COVID-19. Thank you so much for the Colorado Health Foundation for the support around barrier reduction as we get ready to continue on with our webinar series. I do want to welcome Diana Protopapa, who's joined with us from Frontline Public Affairs. Diana and I have had the chance to work together based on some work through the Colorado Cancer Coalition and ultimately looking at some possible preventive care legislation where at the university we've been able to help provide some education background and support. And her and her team have been fantastic in providing the lay of the land related to all things legislative and policy related to access. And I think it's particularly timely as we're coming into this period where we're going to really be thinking about the resources that are available to Coloradans, as well as what are some of the pitfalls with the state budget and what should we really prepare ourselves moving ahead. So with that, Diana, I'm going to go ahead and have you do a better job of explaining who you are and have you jump into the content for today. And a million thanks for Diana for joining us. We really appreciate it.
Thank you, everyone. It's great to be here. Again, my name is Diana Protopapa. I have been a lobbyist since 1999, so I've been down there a long time, and this is absolutely a new environment and a new normal at the Capitol as much as it is for all of us in our everyday lives. I hope that you are all healthy and trying to stay somewhat sane. I find the sane part is a lot harder than the healthy part, especially since I have a 12-year-old and a 6-year-old, so I'm doing a lot of homeschooling. I'll just jump in here to the presentation, and then I'm happy to answer any questions. So there's my contact info. Please feel free to reach out with any questions you may have following this presentation. I'm going to take just a few minutes to kind of run through the legislature and the makeup, because I'm not sure any of you know this. And you might be a very smart audience and know this, but I find with a lot of our clients, they're really not quite sure. So we are a royal blue state. That happened in the 2016 elections, surprisingly, considered Trump won nationally. Everything went blue. I'm sure you all know we have a Democratic governor, Jared Polis. However, our Secretary of State is a Democrat, our AG, Attorney General, is a Democrat, our Treasurer is a Democrat, and the House is controlled by Democrats by more than, let's do the math here, 19 members. So there is a 19-member lead in the House, Democrats controlling. And then there are 2 more Democrats in the Senate than there are Republicans. It's important to note, it's just important to know who's in control of each chamber, because whoever's in control gets to set the calendar, gets to determine what bills go to what committees, gets to determine who sits on those committees for their party. Of course, the Republicans get to pick their own members for those committees as well. But the majority party in each chamber also gets to say, you know, if there are more Democrats or Republicans that sit on a committee as well. And interestingly so, we do have more Democrats sitting on a committee, more so than in prior years, because we just have so many more Democrats. So it very much is a progressively run legislature. Last year, it was very apparent that we had a progressive legislature because we had so many progressive bills pass. I'm going to talk a little bit next about what the hot topics are, or should I say were, this session. I like to say it's all the things our clients want. Frontline represents a lot of progressive clients. The vast majority are healthcare. However, we do represent the Fraternal Order of Police, and we do represent the Association of Independent Schools, which are similar to private schools. However, they go through their own credentialing process and are called independents. But outside of those two, the vast majority are healthcare. So this session, we see education. Frankly, it's always a big deal. Budget, always a big deal. Healthcare, if you might have noticed, the governor has taken a liking to healthcare. It's one of his priorities. Last year, he created the Saving People Money in Healthcare office, which we'll talk about in a little bit here, to help people save money in healthcare. And he has worked with the various advocates and some of our clients as well as others to pass measures that will save money in healthcare, frankly. Public health, it is so sexy this year, right? One of the things, and we do represent public health as well. We represent the local public health officials, but I also represent the Colorado Public Health Association. Some of you may be on this call. Hello, if you are. But at the start of this pandemic, at the very, very beginning when we thought, oh my gosh, it might come to the US, quite not sure. So we were doing all the fun things we like to do and rubbing elbows with people we didn't know. That feels so strange to do that today. But back in the day when everything was normal, there were some articles I was reading about that basically said, you don't know public health until you need to know it. So it's not sexy until it needs to be. And you never want it to be sexy because that means big stuff is going down that we don't want to go down. Well, lo and behold, here we are in a pandemic. But fortunately, last session was a big deal for public health because the Democrats understand, embrace the need for public health. Not saying Republicans don't care about public health, just not so much of a priority for them as it was for Democrats. Substance use disorders, big deal. That's been sexy, however, for the last 4 or 5 years. We have an interim committee that studies substance use disorder policies and promotes them in the following session. So there's about 4 or 5 bills based on substance use disorders, how to lower, how to decrease the frankly, epidemic that is in that area and how to increase access to care and services. Economic security, big deal. Last year was a big deal. This year's a big deal. When I say economic security, you may know what that means, but what I'm talking about is affordable housing, education, access to food, access to good jobs. That's become a big deal last year, and we have seen it this year until what just happened. And like right here, affordable housing, that's become a big deal too. Before we get into the big stuff too, I want to talk a little with you about what we were seeing in this session. And this is just a snapshot. It's not all the healthcare legislation we saw, but I wanted to include things that you might care about. And so let's start with House Bill 1001. Nicotine production regulation. This would be the bill that would create statewide licensing and regulation of the tobacco and nicotine and cigarette product retailers. And that bill was going through very well. It was very likely to pass before everything came down to a grinding halt. I mean, that did face opposition from the retailers, but they were also trying to work with the proponents of the bill as well. House Bill 1061, I call this is the beginning of the mandate bills. I want to pause a moment to say that I have never seen so many mandate bills in one session, and it's just very unfortunate. I represent the Colorado Cancer Coalition. That's not unfortunate, but what is unfortunate is that we introduced a mandate bill during a year of mandate bills, and we didn't know that. I had no idea there would be 8 or 9 mandate bills this session, hence here they are. Here's one of them, HIV infection prevention meds. So it would allow pharmacists to prescribe and dispense HIV prevention medication, and it would require insurers to cover the prescriptions, hence the mandate. That was flying through as well. There is a major hiccup with all the mandate bills that I will talk about when I'm done talking about the mandate bills. 1086, coverage of mental health wellness exams. This is coming from Daphna Michelson-Janae, who is she's an Aurora Democrat. Mental health is a major priority for her. So she's running a bill, or ran a bill, I should say, this session, that would require insurance to cover the entire cost of one annual mental health exam a year for all patients. As you can imagine, I thought this would be very expensive, not as expensive, well, according to the health plans, not as expensive as I thought it would be. This is the Cancer Coalition's bill, colorectal screening, House Bill 1103. This would lower the age for your first screening from 50 to 45, and it would require insurers to pay for the follow-up colorectal if you started with a non-invasive exam. I have to tell you, there's a lot of giggles about our bill, not because of what it does, because of what it's about. So I've heard everything from poop in a box to cover your ASS Colorado to you name it. It's kind of like, it's brought a lot of giggles despite the very relevancy and seriousness of the bill. And our bill was set to pass too. House Bill 1160 is not a transparency bill, mandate bill, but it is drug price transparency. This bill was worked on last year and failed, and this year the proponents and sponsors think they got it right. It's basically bringing some sense and explanation and understanding of prescription drug costs in this state at least. Again, that was before COVID-19. The tanning device bill, House Bill 1340. This is not the first time I've seen this bill. This might be the third or fourth time I've seen a similar tanning device bill, but this one would require tanning facilities to keep disclosure of risk forms and also prohibit those facilities from allowing minors to use them. I'm not intimately connected with that bill, so I don't know how well it was going or what chamber it's in or anything. Senate Bill 156 would basically expand preventive health care services that are required to be covered under state regulated health insurance and codifies other services into state statute. And the reason why I put it on here, it increases Medicaid coverage for family planning services. Not very familiar with this bill either, but always good when we can increase coverage for family planning services and Medicaid. So a note about these mandate bills. The health plans were vociferously neutral on these bills, but spared no energy and letting all the legislators know exactly how much each of these mandate bills would cost. And they have been lobbying the governor on the side, basically saying, look, you want to save people money in healthcare, these mandate bills are going to cost a lot of money. One bill that I forgot to put on here that let me mention really quickly was I call it the Ivf Bill. Basically what it did, excuse me, my voice is getting dry. It would have covered up to 3 rounds of IVF. For all health plans would be required to cover up to 3 rounds of IVF for an infertile couple. That bill made it to the governor's office first. Before it made it there, the governor's office reached out to each of us that were running a mandate bill, including me, and basically said, look, the feds might look at this as a new coverage under the Affordable Care Act. If they do, the state is on the hook for the difference in premiums from the current premium to the increased premium because of your mandate. We can't afford to be on the hook for the difference in those 2 premiums. So we want you to add an amendment that basically states that if the feds do come down and say, look, this is going to increase, it's a new mandate, therefore it's going to increase premiums, the state is not on the hook, therefore the bill does not take effect because we can't pay for it. This was a mandate that I know the Cancer Coalition struggled long and mighty with, as did all the other proponents of those other mandate bills. And the Cancer Coalition came to a place of, all right, if this amendment is going to keep the bill from being vetoed, we'll accept it. The information I had gotten from the governor's office and from the Division of Insurance is that it's unlikely that they would get that notice from the feds, but we needed to just make sure that we were covered if we did get that notice. So, okay, we were ready to accept that bill. Our bill had made it all the way through the first chamber nearly unanimously, and it landed in the second chamber, and right before everything crashed. It was set for testimony, and we had to cancel the testimony to wrestle over whether or not we wanted this mandate. We decide we want the mandate, and then everything goes into recess. Interestingly, The Ivf Bill made it through the legislature and landed on the governor's desk. During the legislature's recess, and we'll talk about that in a minute as well, the governor wrote a letter saying why he signed into law the Ivf Bill, and then wrote explicitly in that letter that he would not sign any other mandate bill unless it related directly to COVID, because he wants to save people money in healthcare. And mandates, though, they are very, there's a lot of merit in them, and they're very good bills. They would increase, they would increase costs in healthcare, i.e., meaning the insurers would pass over the costs to the insured in the way of increased premiums. So he made it really clear he was not going to sign any more mandate bills unless they were directly related to COVID. That's the state we're in right now with regard to the cancer bill and the other, and the state all the other mandate bills are facing. So let me explain why mandate bill is expensive. So what the insurers do is they look at covering the mandate, what it may be, and those are additional services they're going to have to provide, which is going to increase the cost. Well, obviously, instead of the insurers eating that cost, they're going to pass it over to their insureds, their policyholders, by the way of increased premiums. So that's how it increased costs. Now, we created a cost-benefit analysis of our bill, the colorectal screening bill, to show that it's actually going to save dollars because your screenings are catching cancer or precancerous tumors and polyps before cancer begins, so therefore it's saving money. But it's going to cost a little up front before you get into the cost savings. I hope that helps. So then legislature recesses on March 15th. This has never happened in my 20-some years of lobbying. This came about right after the superintendents of the state decided to put schools into a 2 to 3 week recess. I think that was on March 12th. The legislature had to write a proposal, a law. It was not a law. I can't think of the word right now. Oh my gosh, it's escaping me. It's similar to a bill that would recess the legislature for 2 weeks. And they were supposed to come back on March 30th to determine whether or not they should continue meeting or they should continue to recess. In the meantime, they had a question that they could not answer. The state legislature didn't know if they recessed, how much time they'd have available to them when they came back. So let me back this up for a moment. In our state constitution, it says that the legislature shall meet 120 calendar days. However, Joint Rule 44, which pertains to, interestingly, public health crises, states that the legislature shall meet consecutive days. So the legislature was kind of like, well, what is it? Do we have to meet consecutive days or calendar days? And this is important to know, because if it's consecutive, then the 14 days that we're recessing will be taken away from us. But if it's calendar, we'll still have the remaining, I think it was 58 days, that they were in day 58. They had 58 days left on the day they recessed. They would have those 58 days left to play with. So while we recessed, the Supreme Court, or the legislature asked the Supreme Court to weigh in on that. I will tell you that the Supreme Court determined that they actually have calendar days. So they still technically have 58 days left to meet to discuss the state's matters. And we'll get into what that's going to look like. In the meantime, the governor and various counties pretty much shut down Colorado by issuing a safe at home executive order, which basically meant do not leave your house unless, do not leave your house, do not collect go, do not pass go, do not collect 200, you name it. Leave your house only for groceries, but it's indicative and it's imperative that you stay home. Just recently, he lifted that a little bit to safer at home, which is kind of like, well, you really still shouldn't leave your house, but you can leave your house if you need to, but only really for essential things. Unless, of course, if you want to meet people in public. And if you meet people in public, it should be no more than 10 people. But maintain 6 feet of distance and, of course, wear your mask, but really don't leave your house. So it's a little confusing, but we are under safer at home rule. Businesses are slated to start cautiously reopening on May 1st, which is tomorrow, except for Denver, Jeffco, Adams, Douglas, Arapahoe, Broomfield, maybe I think Boulder, who have extended their stay at home until May 8th. So we've got 2 different rules now to apply, to work with. I think personally the governor has did a fantastic job of being really transparent and really getting a hold of what's going on. If you go to covid19.colorado.gov, and you may already be very familiar with this, you can get access to all the executive orders, the public health orders coming from CDPHE, the orders coming from the Division of Insurance, it's all there. You probably are already aware of helpcoloradonow.org. This is something the governor put in place and gave it to Mile High United Way, which is another client of mine, to be the fiscal agent of all the monies that the governor asked the community to contribute to help the various not-for-profits in meeting the needs of their population. And you'll see here underneath that I put those that meet the 3 criteria are eligible to apply. And you'll note there what those are. So I think we've got I personally think Colorado's got a great handle on what's going on, as good as any handle we can have. That said, I do have this amazing video I want to share.
I really don't understand why everybody isn't following the same rules right now. They're very clear, so let's take a minute and let's go over them again. First, you must not leave the house for any reason, unless of course you have a reason, and then you may leave the house. All stores are closed except those that are open, and all stores must close unless, of course, they need to stay open. This virus is deadly, but don't be afraid of it. It can only kill people who are vulnerable and also those who are not vulnerable. We should stay locked down until the virus stops infecting people, and it will only stop infecting people if enough of us get infected that we build immunity. So it is very important that we get infected and also do not get infected. You should not go to the doctor's office or the hospital unless you have to go there, unless of course you are too sick to go there. This virus has no effect on children except for those children in which it affects. The virus remains active on different surfaces for 2 hours or 4 hours. Or 6 hours, but in most cases it's days and not hours, and it needs a damp environment, or a cold environment that is warm and dry in the air, unless the air is plastic. Schools are closed, so you need to homeschool your children unless you can send them to school because you are not home. If you are at home, you can school your children using various portals and online classrooms unless you have poor internet, more than 1 child, only 1 computer, or you are working from home. Baking cakes can be considered math, science, or art. If you are home educating, you can include household chores within their education curriculum, and if you are home educating, you may start drinking at approximately 10 a.m. every day. If you are not home educating children, you may also start drinking at approximately 10 a.m. Masks are useless at protecting you against the virus, but you still need to wear one because it can save lives. And in some cases, it may even be mandatory, but also maybe not. You must not go to work, but you can get another job, at which point you may go to work. Stay home. I don't know how many more celebrities we need to have tell you how important it is to go outside and take care of your mental health. There is no shortage of groceries in the supermarket. There are simply many things missing. You don't need to go buy a bunch of toilet paper, but you should buy some in case you need it. If you are sick, you may go out once you are better, but those in your household, they cannot go out once you are better unless, of course, they need to go out. Animals are not affected by the virus, except for that cat that tested positive in Belgium in February, plus a couple tigers. The number of corona-related deaths will be announced daily, but we don't know how many people are infected because we were only testing those who are almost dead to determine if that's what they will die of. The people who die of corona who are not counted won't or will be counted, but maybe not. To help protect yourself during these times, you should be eating well and exercising, but exercising only eating what you have at home to avoid going to the stores unless you need toilet paper or a fence panel. It's important to get fresh air, but don't go to parks, but do do go walk in other places. Just don't sit down unless you are old or pregnant. But if you do sit down, don't sit for too long unless you are old and you are pregnant, in which case you need to sit down. But if you do sit down, don't eat unless you've had a long walk, which you are allowed to do if you are old or pregnant, except for times in which you aren't. Don't visit old people, but you have a moral obligation to take care of old people and bring them food and medicine. And finally, no businesses will go down due to coronavirus except those businesses that go down due to COVID-19. I hope this cleared up any questions about what we should and should not be doing during this time. Please educate your friends and family with this information so we can remove any and all confusion surrounding this time. Thank you.
Okay. I couldn't help it. I thought that was a great video.
And Diana, we got some comments from folks wondering if you could share that, but that was spot on, clear as mud, as you said. That was fantastic.
I mean, it doesn't get, and it actually works. Like when Andy or Aaron actually send you the link, it's embedded in the PowerPoint, so you'll be able to watch at least that little video. But yeah, I mean, I just spot on. I watched it. I couldn't help it. I'm like, I have to share this because it's so true. Okay, before we go into the consequences, we're going to talk for a few minutes about the budget. I do want to give you an update, and give me a moment. I don't think I have a slide on that. No, I do have a slide. So let's start with the consequences. So we learned recently through one of the legislative fiscal forecasts that we are facing, I thought it was $2 to $3 billion, but what I've heard recently, it's a $3.7 billion deficit. Our budget is $13 billion. So you can imagine how this is going to eat into our budget. Recently, the Joint Budget Committee staff, so let me tell you, the Joint Budget Committee, for any of you who do not know this, is made up of senators and House representatives. Right now, there's 6 of them. There are now more Democrats than Republicans on the Joint Budget Committee because it's based on who's in control of each chamber. And remember, I said Democrats were, so they have, I think, 1 more Democrat, maybe 2 more Democrats on it. They are what we call the budget writers. They take the governor's budget requests and his department requests into account, and they write up what the following year's budgets should be. That's our JBC. Once they're done writing that budget, it goes to each chamber to be voted on. And there's a whole host of rules around that and what that looks like. And I'm happy to answer questions around that, but I'm really not focusing on that at this time. So the JBC staff, they have an amazingly wonderful, very smart staff that understands that each department's budget, frankly, far better than the legislators who sit on the Joint Budget Committee, because that is their job, is to study the budget. And they know the budgets and the department's budgets very well. So the staff recommended department cuts. I think on Monday, they came out with those recommended department cuts. The JBC has not taken any votes on these recommendations. This is just JBC staff recommending those cuts. This does not reflect proposed budget cuts or budget balancing actions recommended by state agencies through the governor's office. Those will be coming out, I think, on Friday. And that is posted through what is called the Office of State Planning and Budgeting, which is the governor's budget office. The JBC is different than the governor's budget office. So oftentimes when we do a fiscal forecast, we hear from OSPB and we hear from JBC. And it's not surprising when I say that they're not always aligned, which is kind of fun to figure out who's going to win that little battle. The JBC will not begin meeting until May 4th. They're going to meet remotely. They will not receive revised revenue projections until May 12th, so they really can't even start acting on any recommendations until we have this fiscal forecast or revenue projections, if you will, on May 12th. May 12th may come back and say, whoa, we need to cut $4 billion from the budget, or it may come back and say, really only, $2 billion, really, it's $2 billion is a lot of money. So they really can't start acting on recommendations until after that revenue projection. You'll see at the bottom here that I included a link for you to read the budget overview and those recommendations. I've added some of these cuts. My clients, I should say our clients, Frontline Public Affairs, there's me, Jennifer Miles, and Adeline Hodge. We all make up Frontline Public Affairs, along with Katie Patchinson-Jacobs, who is, she's our wonderful policy analyst, staff, everything. She's amazing. The four of us make up Frontline Public Affairs, and we've represented a lot of interest groups who have put these programs in place. So it's been really hard for us to read these recommended cuts because they represent years of hard work that we've put in to pass these measures in the first place. So I'm going to start with right here. You'll see eliminating the $2.5 million that they've allocated for immunization outreach this year alone. 1.5 million would go directly to the local public health agencies. The other 1 million would be for an ad campaign and increasing access to vaccines. Yeah, you may, and actually I can't believe I didn't put that bill on the list, Senate Bill 163, which would be basically, I don't even call it increasing access to vaccines. It kind of modifies the process in which people can get vaccinated, or rather really exempting themselves from vaccinations. That bill basically combined the religious exemption and the personal exemption as one non-medical exemption, and then you had your medical exemption. It would require those who wanted to get a non-medical exemption to either get a signature from a prescriber who administers vaccines, or to go online and watch an online module on the risks and benefits of the vaccine. You print out the page that states you watched it, and you sign it, and you submit it into CDPHE or your school. The bill also allocated money, like I said, for some outreach for schools to increase access, and required schools to disclose their MMR rates compared to what the CDC rates are to all the parents of that school. So that bill made it through its first chamber, is stuck in the second chamber. I'll talk about what bills are likely to come back when the legislature reconvenes. This bill is unlikely to come back, and we'll talk about that in a moment, though all of the proponents, including me, are hoping it does come back. Okay, so jumping into the cuts, I apologize for that little the departure I just made. So let's talk a little bit about it declares a state fiscal emergency to allow transfers of up to $10.3 million from the Tobacco Education Program Fund, which is 50% of the total, and up to $7.4 million from the Prevention, Early Detection, and Treatment Fund, which is a 33% cut for breast and cervical cancer, and others you'll see there, to the General Fund for Medicaid expenditures. So they're taking, it's kind of like, robbing Peter to pay Paul in a way. Transferring $160,000 in tobacco master settlement funds for oral health programs to the general fund, though they indicate federal funds may be available to offset this cut. Reducing, that's the marijuana tax cash fund appropriations of the Colorado Health Services Corps by 20%. The Health Services Corps, in case you're not familiar with it, is the program run out of the family planning, of the primary care office in CDPHE that is student loan repayment to those providers who are willing to work in underserved and rural areas. So that's taking a cut as well. 50% cut to the human sexuality education program. We've always had sex ed programs in the state of Colorado for, 20 years. Last year, they ran a bill to provide grant dollars for any schools who wanted to provide the sex ed program but didn't have the money to hire the instructor, the materials, etc. That was a $1 million grant. We just cut it in half with this recommendation if the JVC accepts the recommendations. 33% cut to the CARE Network, provides medical exams and behavioral health assessments to children who've been physically or sexually abused. 4% tuberculosis control and treatment, a 20% community crimes victim grant, 10% child fatality prevention line item, 20% family planning. That includes long-acting reversible contraceptives. You remember in the last few years how hard we fought to get the $2 million into the state budget. They're cutting that by 20%, or let me say again, that's the recommendation. 20% cut for school-based health centers, 10% office suicide prevention, and that's just a few. They cut into human services, they cut into education, they cut into public safety. Every department there is, the JBC has made recommendations for cuts. It will be interesting to see what the OSPB comes out, which will reflect what the departments want to cut and not what the JBC staff is recommending. So it'll be the JBC's job to kind of marry those two recommendations to determine what they're going to cut and then ask each chamber to vote on that. So right now where we stand, legislature reconvenes. That is a lie. I don't know why I put May 12th. It's May 18th. That is the strong recommendation. That is, of course, up for change due to what's going on with COVID-19 in this state. I mean, I'm not an expert on COVID-19, or even though I represent public health, I play one on TV. I'm really not a public health expert. Something could happen where they're like, we have a huge resurgence of COVID-12. We need to go back down on lockdown again. I don't know what will happen, if that will happen at all. But if all looks as it does now, they are slated to start again on May 18th. The only two things the legislature is required to pass is a state budget and a school finance act, which spells out how schools will be financed and how they're going to pay schools, the money they're going to give schools to operate and run and pay the salaries of the teachers and superintendents and staff, et cetera. You know, how many dollars will be appropriated to each student, et cetera. Those are the only two things they are required to pass. Okay, rumor has it, and that's all it is right now, we have not got anything specific from legislators who have committed to say that they're going to meet past 2 to 3 weeks. Everything we hear is 2 to 3 weeks, 2 to 3 weeks. The new budget has to start July 1, I believe. So I think it's July to June is when it goes, or maybe it's June 1st, now I'm forgetting. But they want to have the budget neatly wrapped up to give to the state departments to implement the 2019-20 or 2020-2021 budget in time for June or July. I forget the start of the state budget. Now, that said, they are talking about COVID-related proposals. What does that look like? Well, we know it can't be a stimulus package because there's no money for that. However, some of the things I'm hearing is a telehealth bill. Right now, the Division of Insurance and the Department of Regulatory Agencies has put out some orders to expand how telehealth is currently used right now in this pandemic and who can provide telehealth. That's an emergency order that providers and patients are working under right now. Well, some of those providers want to codify that into permanent law. So when that order is lifted, telehealth can continue as it exists right now under this pandemic. So there's a coalition of folks meeting. I'm part of that coalition because we also represent physician assistants and certified nurse midwives. We also represent federally qualified health centers. So we're part of that coalition to see what this telehealth bill will look like. That is considered COVID related, or at least that is what some legislators are thinking. So they're going to push to get that introduced. It'd be a new bill. Now, I'm talking about COVID related bills. That said, the Speaker of the House has deemed that any COVID related bills or new bills or existing bills that are waiting to be heard still have to be fast, friendly, and free. Fast meaning it could be done in and out. Friendly, very little to no opposition. And free, no fiscal note. So if you don't know what a fiscal note is the cost it would take to implement the new bill. So let me think of a bill that costs money. There's a bill right now that would create a driver's education program for foster kids, for foster youth. They created a grant program so that the state could pay the counties to administer this driver's ed for foster youth. And the cost of that bill was, I think, $600,000. That bill, oh, actually, I'm lying. It was $66,000. That bill would go away because we don't have $66,000 to implement the new bill when we have $3.7 billion we need to cut from the budget. So any bills with fiscal notes they're dead on arrival, according to what they're saying, not what I'm saying. I can also share with you, rumor has it that the Senate Democrats and the House Democrats are on the same page. The Senate Democrats want to get in and out, do the budget, the School Finance Act, maybe a few COVID-related bills, and get out of there. The House Democrats are more inclined to pass some more progressive measures, and there's a reason behind this. Remember those earlier slides when I was talking about the number of Democrats in each chamber versus Republicans? There's 20 some more Democrats in the House chamber, pretty much giving no power whatsoever to the Republicans in that chamber. They are so outnumbered that they can't impede a process or slow down the process much. However, in the Senate, there's only a two-person lead between Democrats and Republicans. Republicans have a lot more power to slow down that clock and interrupt the process for bills they don't like. So the Senate Democrats have to work with the Senate Republicans when it comes to the calendar, the legislative calendar, when bills will be heard, when they'll be debated, etc. Whereas the House Democrats don't necessarily need to do that with their Republican counterparts. This is all, no legislator has necessarily come out and stated that publicly. It's just what the lobby corps has pretty much surmised why there's such a difference between the Senate Dems and the House Dems. Also, it's an election year. Legislators, particularly those in dispute, like up for grab seats, those that have the demographics are really close between independent, Republican, and Democrats. Those seats are, they're coveted and they have to work hard to keep their seats. So they need to campaign. They need to, if they could walk doors, they'll need to do that. They need to ask for money. So the debate is, we really don't want to be there that long because we want to get back to campaigning. That's kind of what the makeup looks like moving forward. I just got off of a call today that talked about the lobbies of the Capitol. So if you've ever been there, you'll know that there's two chambers. One is the Senate, one is the House, and right outside those chamber doors there's literally a lobby where us lobbyists meet and hand in cards to pull legislators outside of the chamber to lobby them. Those will be closed. And in fact, they're encouraging lobbyists not to come at all, but just to text and email them. They will be spreading out the legislators in their chambers for at least 6 feet apart and using the galleries above where public bystanders could listen in and placing legislators up there too to create that 6 feet of distance. They are allowing legislators that are high risk to vote from home. They are trying to figure out what testimony is going to look like. They're not closing the building to the public, but they're highly encouraging everyone to stay home. So they're now in the process of figuring out, what is testimony going to look like? Are we going to do remote testimony? If so, how does that look? Because right now we have capability for remote testimony, but you have to go to a university or other public building, and those may not be open, or they need to protect public safety if people go to those buildings to testify. That's still up in the air. That's pretty much where we are with moving forward. And that is it.
Awesome. Diana, thank you. That was excellent. I think we've got some good comments and questions. You've hit a couple. But Diana, one of the questions, and I think I'll springboard on this, is also ultimately, you talked a bit about the state level, but the 3 Fs, right? Is it feasible to have a COVID-related stimulus help with that under that 3 Fs, like to your point around what kind of support, and is that even feasible? I mean, in your crystal ball, do you think there is anything that could actually pass through given that sort of need to not have any cost, fast, friendly, free? Like what are your thoughts there?
On whether something can pass if they're fast, friendly, and free?
Yeah.
One of the legislators I just spoke with this morning, she's in the Senate, and she said that they are prioritizing COVID-related bills and what those will look like, and they are going to assign them to legislators, the senators. The House is doing something similar. The House is doing something a little different, and they're asking each of their legislators to look at their remaining bills and make a case for if they should move forward. So now what I'll tell you this too is, and Andy, you know this, but it has to go through both chambers to pass. So if a bill is still in its first chamber, the likelihood of passage through the whole process is lower than a bill that's in its second chamber. So those are things they're looking at as well. So yes, I think it's possible to have some COVID-related bills pass. I do. How many? I don't know. The substance of them, I don't know. I can't imagine they're going to have a lot of bills of great substance that are COVID-related pass in 2 to 3 weeks. Well, but though technically, it really only takes, I believe, 3 days to pass a bill. And without going into all the rules around what that looks like, I think it takes 3 to 4 days to pass a bill if they lift certain rules and they have the power to do that.
So great. Yeah, so it'll be interesting to see what that looks like. And then I think there's a couple questions that are talking about on the federal front and what that might mean for Colorado. Any idea what the feds might be doing that might actually impact our state, Diana?
I'm kind of wading into waters that I'm not very familiar with, and I always get in trouble when I do that. But from the last I read, I don't think we know how much is coming our way. And we might know by now, but the last article, I do know that a lot of the funds are restricted from supplanting deficits in the budget. So you can't take the funds we're getting to fill like $1 billion of the $3 billion shortfall we're facing right now. I do know that the last thing I saw that each department would be getting money, but let me go back to some newsletters we wrote where Katie, our policy analyst, who's like brilliant, had put some information on what the federal dollars are doing. I'll send them to you, Andy, for you to share.
Okay, great. Because I do know in terms of also part of that field implementation work, there's been discussion about from the governor's office or from FEMA, what tracing efforts might look like, what some of the others, and everyone's just kind of waiting to see what that looks like. So as we hear about those, as we, Diana, as you guys do a little bit of research, we can put those out to folks as well. Good questions. And I think building now from the state, federal level, there's a specific question of what challenges does this situation pose in city, county, or municipalities that have their own regulations related to COVID. So I think anything about city and county level and any funding implications there that you know of, Diana?
So I'll share with you all a little inside politics, but
don't tell anybody else. Yeah.
No 66 of you can tell anybody else, right?
Yeah.
And it might already be known very well, but I do know that the governor has done a really good job of working with the local public health agencies in determining what this looks like, what we should open up, how we should open up, when we should open up. And from my understanding, the local public health agencies were more conservative than what the governor believed needed to happen. So from also what I understand, there was an agreement made where the governor said, look, I'm going to do this safer at home. You all do what you think is best for your counties, which is where they came up with that bi-level system that is kind of, not helpful for anybody, frankly.
Okay. And we'll just keep an eye on that as well. I do want to ask, there's a specific question about the new Ivf Bill, and since that was signed and made it through in some sort of magical way, when will that new bill when will it come into effect? How much is allocated for that? And how will it impact hospitals, clinics, and from the implementation side, Diana?
Okay, so the bill, I believe, I'll look it up, but I think it takes effect July 1, I think, but I'll look it up and I'll let you know. If you don't hear from me, it's July 1. The bill did pass with that amendment on it that we talked about for all the mandate bills where the state is not on the hook for the increase in premiums if the feds determine this is a new mandate. So if the feds come down and say, oops, you created a new mandate in the Affordable Care Act, so Colorado, you have to pay the difference, the bill does not go into effect. I don't know how it impacts community clinics and FQHCs and such. If you are, I have Kaiser. Under Kaiser, this will be covered. So if I go through IVF, I'll have 3 rounds covered for me under Kaiser, as is United or Aetna or Cigna, if that makes sense. So I don't know that impact. I know for FQHCs, the vast majority of their clients are Medicaid. So Medicaid is not included in this.
Okay, that's a really good point. So it's more of an insurance coverage as opposed to the place of care. Well, I think that's exciting though, and definitely interesting. There's a question from Samantha. So Diana, I guess thinking about, and I'm just also kind of adding in on some level, I guess probably the last recession that we saw was probably 2008, but based on that or other periods of time that we've seen this sort of like repressed and really depressed economic state, how long would you say that it takes to get out of this sort of a deficit? Is cutting the budget worth the negative impact this will have on the people of Colorado? So any specific answers for Samantha?
Great question. I recently heard it could take us 7 years to get out of this deficit. Next year, there's really not going to be any money for new programs either. There's not going to be any money to restore the programs we have to cut. Don't forget, and we did not talk about this, and I am not an expert, but let's not forget about TABOR, Taxpayers' Bill of Rights, which is a constitutional requirement that the state can only keep so many dollars before they refund them back to the taxpayers. Now, this year, there will be no TABOR refunds this year. And let me remind everyone that a TABOR refund looks like $50 to $100, like maybe Starbucks for 2 months. That's your TABOR refund, which hamstrings the state into keeping more money to feed these vital services. This is going to impact Coloradans a lot. Is there anything we can do about it? There's going to be a lot of cuts in education, a lot of cuts in Medicaid. You cannot touch. It's a mandated, they call it entitlement. I always hated that word, but that's what it is, an entitlement. So as Medicaid increases, and you can bet Medicaid's going to increase here, more dollars need to be fed into Medicaid, which means transportation, education, those are going to be cut. We're going to see a lot of unhappy people, in addition to these vital services that we've built over the years for people in need.
Mm-hmm. Okay, thank you for sharing that. So there's 2 questions that are, I think, kind of piggyback offing each other. Specifically, how does this affect and impact Colorado hospitals? Are there pandemic bills that allocate health services and hospital operation rather than cutting during a crisis like COVID?
There are no bills yet to aid hospitals. One of the reasons we went to Safer at Home, and remember, and you all know this, I don't need to say it, but remember, the Safe at Home executive order and it was not to prevent people from getting COVID. Well, of course that helped. We wanted to prevent people, but the overall purpose of Safe at Home was to not overwhelm our healthcare system, so that the hospitals were not overwhelmed and could actually help the people that went there. Hospitals have empty beds right now. They're in good shape, which is why we lifted it to Safer at Home. Personal protective equipment is still sorely needed. Hospitals, though, they're not being sorely strained like they were originally. So they've got some breathing space. Hospitals are stating that there's a lot that are going to shut down, particularly the rural ones as a result of COVID-19. However, Denver Health, who we do know is largely Medicaid, just gave out huge executive bonuses while they were furloughing providers and asking people to take time off unpaid. And in the process of all that, they gave their executives huge bonuses. It was an article in the paper that I can share too. So I think some may be talking out of both sides of their mouth there. I don't know how you can give huge executive bonuses, even though those bonuses were based on prior year's experience. I don't know about you, but if you're requiring people to take time off unpaid, should others really be getting like $500,000 bonuses? That's just me just saying.
It's a good point. Yeah, that was really a bit distressing to see that in the paper, especially I know that we have many people in said communities that are working on the front line and working nights with limited resources, and it was disappointing. There's one other question from Betsy that says, when you say Medicaid is mandated, is this only for medical side? I'm seeing that the dental portion is recommended for cuts.
You know what? I'm not a Medicaid expert outside of knowing that it's an entitlement. So you have to pay, you know, people have a right to be on it if they meet eligibility requirements, and you have to pay for those services. That's a great question that I don't know the answer to, but I will ask Jennifer, who is our Medicaid expert.
Okay, wonderful. So let's see, is the adult dental benefit, dental benefit is not required. So
I'm not sure.
That's what, okay. That's what we see coming into.
Okay.
So we are 1 minute. So I think this has been a famously timed presentation with really great questions. Coming out of today, Diana, you're cool. We have this recorded. We're going to share your slides in PDF. You're cool with that? Okay.
Yeah.
And then Diana and her team from Frontline will come share the perspective on the research of some of those things that we've talked about today. And then I think some of those larger COVID-19 resources are saved onto PNTC website as well. And so Diana, I'll give you the last word and then talk to Erin about shutting us down around eval. So Diana, anything else to share?
No, I think I covered it all for now. Stay tuned.
Okay.
It'll be interesting to see what happens. I do not want to go to that Capitol personally. Like a petri dish. So, I mean, yeah.
Yeah. Well, you know, a little Lysol and sunlight will help anything. So there you have it. That's just what I heard. Just kidding. That was a bad joke. But I do know there's one other question just quickly, and then I'll punt to Erin. Are there state budget allocations for frontline providers for supporting them, frontline providers for supporting them on the front line during the pandemic? And I think you said right now, Diana.
Now, the one thing that I didn't mention that I should have is that, interestingly, and I was not aware of this until recently, that Colorado has an emergency fund of $100 million. So those funds can be distributed as necessary and needed. And I know they've given $700,000 to United Way's 211 call program, which is a statewide call that people can go to for certain, referrals to certain, needed services. I'm not sure how else those emergency funds have been spent there, but there was $100 million in there in April, I think. So, yeah.
Okay, good to know. We'll add that in too to see if we can provide a little information about that. Erin, anything else as we round out the day?
I ask that you all just fill out our less than 1 minute survey that will pop out when you close the webinar. I'll also include it in the email in case you miss it. And yeah, watch for that follow-up email with the slides, recording, and those other resources we will provide for you. Thanks so much for attending.
Great. And then what
Diana.
And thanks huge for Diana. The PNTC will be launching a webinar series also with the Alliance around mental and behavioral health resources. Going to start integrating a bit more discussion about COVID-19 related resources as well. The registration is open for that. It will be a series that starts in May and finishes in early June, every Wednesday afternoon. So please join us. Erin will go ahead and send that out as well. We'd love to have great participation. All right, awesome. Okay, Diana, a million thanks. Everyone, thanks for joining. We'll be following up. Have a great afternoon.
Thank you.
Bye-bye.